Welcome back to today's anatomy question. I'm the clueless Lizzie Lassiter, who's been studying anatomy for years with the absolutely brilliant Mary Richards. I bow at the feet of our teacher, Mary Richards. I learn something new every single time we work together. Thank you so much for being here.
It's my pleasure, Lizzie. And you're as far from clueless as a person can be. Okay. I just want to put that out there. You are very curious, though, which I celebrate.
I have three websites to share with you before we start. The first is Mary Richards' website, Yoga with Mary Richards. Go here, find out what Mary is up to. And I do hope you'll subscribe to our Experiential Anatomy newsletter, which you can find at experientialanatomy.yoga. Free videos there, etc. Plus announcement when we run our flagship course. The last thing I want to show you is Mary's new book, which I have read, is fantastic. It's called Teach People, Not Poses. You can find it where you find books. I'll put this link in the YouTube, whatever it's called, caption, notes, description. I'm good at YouTube, okay? We're really good at YouTube. The question today, Mary, is talk to us about the hip joint, specifically the bony landmarks. What can we see from the outside? What can we feel when we touch our bodies? What do we need to be looking for when we teach yoga?
Okay. So the first thing I'd like to plant in our minds right now is that the axis of the hips, the transverse axis of the hips, are the primary axis of movement in the body. Really, it's the hips are where the action happens.
Like what action? Like all the action in the body, all the movement?
Of the action. Like I was like, don't say that. Not that type of video. Like walking, running, sitting, standing, jumping, dancing, any movement that you can think of that's not like a fine motor skill, but we're talking about gross motor movements, especially relating to locomotion, occurs from the hips. It's the rear wheel drive of the body, if you will. So,
all right, I suggest we pull up pocket anatomy, so we can see the visualization of the pelvis and understand, and then maybe we can map this onto my body, onto our own bodies to understand. This is a kind of X-ray vision. What are we looking at here, Mary? What's important for us to
yes.
know,
Okay,
to
so
locate?
I want us to look at the long thigh bones, the femurs.
Mm-hmm.
Okay, so those are the longest bones in the body. And then you'll notice on the top, near the top of the thigh bones, proximally, meaning closer to the head, you'll see on the outer aspects of the bones, you'll see these knobs, these kind of flattened knobs. Those are called the greater trochanters. And a bunch of musculoskeletal tissue, myofascial tissue, muscles, IT band, etc., cross over these greater trochanters. So the trochanters are really important because if we then look at the body from the front again, we'll see that the greater trochanters sit on the same plane or level line as the pubic bones.
Yeah. Okay. Pubic bone is here.
Yeah.
So let me see if I can draw a line. Yes, I can draw a line. Okay. So just kind of like pubic bone.
Yeah, that's the pubic symphysis or symphysis, depending where you're from. And it attaches to the pubic rami, which means ram's horn. So those are the pubic bones. And you look, as you draw that line from greater trochanter to the center of the pubic bones, it's a level line. And that right there, then we know we're looking at approximately the bottom of the pelvis. So we know that this is where this is kind of the dividing line between the legs and the pelvis. Okay. And then if we look, you'll see from the greater trochanters, you'll see this little narrowed neck. That's called the surgical neck of the femur. You can't feel it. Don't look for it. You're not going to find it. And then above that surgical neck.
That's here.
Yep, that's the neck of the femur. That's the place of common fracture as we age, especially for folks with osteoporosis. That is where a lot of fracture occurs there at the surgical neck. neck. And then above that surgical neck, we see this rounded head, and that's the femoral head, the head of the thigh bone. And that rounded knob sits in the hip sockets, the acetabular fossa is plural, means caves. So the acetabular fossa, that's the true hip joint right there, what you have highlighted in the blue, where the thigh bone comes together with the ilia, the hip bones.
This
And
is so fascinating to actually see, because if we're worried that we have like hip joint pain, for example, it's not where we would think. Like, hip joint, our hip joint is somewhere different than we commonly kind of imagine, or like man on the street, where's your hip joint? It's kind of like here, like
yeah,
wait, let me draw an arrow. This outer kind of space feels like the hips, but this
exactly.
is so much deeper.
Right. And so we often confuse, like, one of the reasons why it's so important to be familiar with our bony topography, these bony landmarks of the body, is because often when we look at ourselves in the mirror, we're not seeing our structure. We're seeing our foundational structure. We're seeing our soft tissue, which we often have a lot of beliefs and judgments about, many of which are unfavorable. And we have this idea, especially for those of us, who identify as women, like, you don't want to have fat hips, you don't want saddlebags, you don't want, you don't want to be big through the hips. And so we will think of ourselves often as much wider structurally than we actually are. And that affects how we stand, how we walk, etc., because we then tend to try to make ourselves smaller and hold ourselves closer to the midline, for instance, or we'll move out from the midline of the body, too far, which is also destabilizing. So we really want to have an idea of where the actual hip joints lie in the body.
Okay, we're
Because
going to look at my body in just a second. My last question here before we switch out of pocket anatomy is, like, can you give an example as a yoga teacher of something that you're looking for when a student is standing in front of you, practicing yoga, doing a pose? What of these landmarks are you locating with your eye?
So you want to know where the greater trochanters are, because how much of the trochanters you see tells you how much rotation the person has in their hip joints. Are they turning their thigh bones in? Are they medially or internally rotating so that you really see a lot of the outer thigh? Or are they really externally, laterally rotating at the hip joints so you don't see the trochanters at all? Because we want to know what neutral is for a person. And in neutral, you'll be able to, you'll see that, trust me, you'll see the trochanters. Your eyes, with enough practice, your eyes will go right to them, and you could come up with your fingertips and put your fingertips on them, and you're going to be like, oh, okay, this person's standing in neutral, or they're not.
Okay, great. Anything else you want to say before I close this image?
And then let's just take one last look at the trochanter. So you see that big knob on the outer thigh bone, the greater trochanter. Well, then if you look on the inside of the thigh bone, you'll see a much smaller knob. And it sits back a bit. It's not on the front. It's not even on the middle of the bone. It sits behind the midline of the thigh bone. That's called the lesser trochanter. You're never going to look for that on a student. Okay. It's very intimate terrain, but it's important to know that that's there because it's a distal attachment for your psoas and your iliacus.
Oh, isn't that interesting? Okay, let me just spin around a little so we can see it. So it's this little knob.
That knob. And notice, Lizzie, if you keep turning, you can see it's moving toward the back of the bone. That lesser trochanter sits toward the back of the thigh bone. And so then we realize, oh, wow, okay. Notice the lesser trochanters are lower than the greater trochanters. They are on about the same plane as your sitting bones, the ischial tuberosities. Okay. And then if we turn this skeletal image around again to the anterior view, and we look at how low those lesser trochanters are, and we now visualize the psoas and the iliacus, you see how fully those muscles cover the hips.
Yes, and the other thing I was thinking that makes sense with trying to stretch the psoas, why it matters what you do with your leg.
Yes.
Like why you need to stabilize your back thigh when you're doing a lunge and trying to get into the psoas.
Exactly. And why, if you really, really want to stretch your psoas, it helps to internally rotate the thigh bones a bit, because that's going to pull that attachment point back.
Further away from.
Exactly.
Ooh, you sneaky, Mary.
I am sneaky. I am very sneaky.
She's a sneaky anatomy nerd. She can make you suffer with exquisite precision.
It's so true. It delights me so. That's like the highest compliment you've ever paid me, Lizzie.
Internally rotate your lesser trochanter. All right, I'm gonna stand up. Let's get a little bit of a, let me take this off so we can see. So what, this is, I'm Yogi brand X. I'm standing in your yoga class with my Lululemon tights. And what are you looking at? Because, exactly like you're saying, all I see is like, oh, tummy, thigh, like, I'm not like immediately, I have trouble immediately mapping that pelvic image onto where all this is happening,
Yes, absolutely. And, just keep in mind too, that I've been teaching for over 20 years. So I see things really fast. You will too. It just takes time looking at lots of bodies and, without being creepy, right? And so I want you to take your hands to your outer hips, Lizzie. Find your big hip bones first, your big elephant ear like hip bones. And so we feel the ilia, that helps. And then we just slide our hands down our outer hips, and you'll come to these bony knobs. Yes. And now if you look down, you'll see that your fingers on the greater trochanters are on about the same plane as your pubic bones.
True.
Okay. True. So this is very helpful for us. So right there, we know, okay, that's the terminal end, if you will, of the surgical necks of your femurs. And it's at the greater trochanters that your thigh bones start to run down toward your shin bones. Okay. Yep. And now this is great, Lizzie. I love that you did that. So your fingertips are on your trochanters. And now I want can you find a little bit more of your bone? If you push in just a bit and then kind of get under the trochanter, see if you can find its bottom edge, and then move toward the front of your thighs. And are you able then to sort of slide down your thigh bone all the way down to your knee? Yep. Yes. Yes. And yes. And do you notice that it's not a straight line?
No, it's not a straight line.
Exactly, because there are no straight bones in the body. No straight bones in the body. And what you just showed us is you gave us an idea then of what's called your Q angle. Now, this isn't precise. That's another conversation that we'll get to in another video. But now we get an idea of how much your thigh bones track toward the midline of your body. And that would inform, say, if I'm teaching you an active asana class, that's going to inform the instructions I offer you regarding your foot position and your knee position. Okay. Okay. So the greater trochanters are fantastic for most people. If you have an out seam on your pants, and we're both wearing yoga tights, so we don't have seams, but the trochanters would sit just behind the out seam of your pants.
Okay.
Yeah. Okay. So now what will happen, and you'll see this in class all the time, is folks will stand with their feet quite wide, thinking that those greater trochanters that's their hip width. But that's not the true hip width, if you will. Now, it's fine if you have balance challenges. You definitely want a wider base. You probably feel more stable. Yes.
Yes.
Okay, but now I want you to walk your feet in till it feels natural for you. And believe me, the body knows it's orthopedic stacks, to borrow Andre Vleeming's term. It knows it's bony stacks.
Mm-hmm.
Okay, now I want you to, from your greater trochanters, I want you to put your thumbs on your greater trochanters and then your index and middle fingers, point with those. And and slide your fingers along the front of your legs and you'll find a divot.
Mm-hmm.
Yeah. Okay. Now roll your thighs in quite a bit. Take your heels out wider than your toes so it feels a little awkward, but no pain in the knee. And you feel how that divot becomes even more apparent.
Yes.
Those are your hip joints.
So
Okay.
here.
Yes. So we know then when standing that we want the space between the second and third toes under those joints.
What do you mean under? Because they're in front of. But do you mean like under in this line?
Yes. So
like that's the width.
Yeah. We want the center of the heel bones, the center of the knees under those hip sockets.
Okay, so what you're saying is that's how we can find our anatomical hip width.
Yes, that's how we can find our anatomical width of base.
And you use this for Tadasana, or where are you using it?
Oh my God, everything, Lizzie. Certainly Tadasana, but even in Trikonasana, triangle pose. Okay, so how many times, and I've been a yoga practitioner for over 30 years, so I've heard a lot. Okay, all right. So how many times have we been told in Trikonasana to stand so that our front heel bisects the arch of our back foot? Like a million, right?
A million.
And then we've also been told, for those of us who aren't as evolved, aren't as spiritually evolved, well, then you could line up heel to heel.
Heel to heel, yeah.
Okay, that's too narrow for the overwhelming majority of people. That puts people on a tightrope. By understanding where folks' true hip joints are, that's going to establish our width of base. We'll stand more like this in triangle pose with a fist width of space between the heels. And the person's going to be more stable and they're going to have more range of motion because we're organized from our structure then. We're not trying to walk a tightrope or fit in the toaster or between panes of glass. I know I've said this before, break the damn glass. Let's not just shatter glass ceilings. Let's shatter the panes of glass that keep so many of us on this straight and narrow path in asana that does not serve us structurally. It's going to affect. So in Warrior 2, in Warrior 1, we're not going to line up heel to arch or heel to heel. We're going to line up according to our skeletal proportions. And for most of us, and this is just a good kind of cheat, if you will, we need at least a fist width of space between the big toes, the roots of the big toes. Some of us need 2 fist widths. I am a 2 fist width person.
So again, we're finding that I'm going to just go back to pocket anatomy for one last as we wrap up. So what you encouraged me to feel was to feel in to my hip joint.
Yes.
Here. And then you're saying if I zoom out, I should be able to zoom out. Yeah.
Yes.
That should be this point. We want, I'm going to draw a line, bear with me. It will not be straight.
Oh, Lizzie, you're reading my mind. I love you so much right now. My anatomy nerd heart is like huge. Yeah.
Imagine this is a straight line.
And look, it comes down right between, you kind of jiggied at the end. It's not a perfect straight line, but you see how it came between your second and third toes when you look at that?
That straight line. We're all pretending it's a straight line.
But if we stood with our feet together, you can see how that throws out the ankles, it throws out the knees. And where is the compression going to go in the hips? Into your SI joints and into your low back. But then if we stand too far, that's not as much of a problem as long as we don't collapse to the medial compartment of the knee, that big inner aspect of the knee, or the inner aspect of the ankle. That's the key when you're standing with your feet farther apart, is you don't then collapse into the inner legs, if you will. But you can see now why it's so important that we know where these hip joints are, because we want the line to drop from the center of the true hip joint through the center of the knee joint into the central pillar of stability in the feet.
What I love about this, Mary, is that all of the landmarks that you're using to establish your rule of alignment, they're not coming from the outside, they're coming from your own body. So it's like locate your own hip joint, locate the space between your second and your third toe. Those are the points of reference. It's not like locate your teacher's teacher's teacher who said that the heel should be in line with the middle arch, and then trust him and forget about what it feels like in your body. It's like locate these reference points. And so therefore what follows from what you're inviting us to teach and to practice is like, if you have a wildly different shape, then your pose might look wildly different, because that's the shape of your pelvis and that's where your feet are. Like,
yeah, teach people, not poses.
What a great product placement. Okay, wait, we got to show the book one last time as we say goodbye. Mary Richards is the author of Teach People Not Poses. Fantastic. Should be on every yogi's reference bookshelf. It's a great, great, great resource. And please visit yogawithmaryrichards.com. That's the place where you're going to find Mary, everything she's doing, her social media, her newsletter. And we collaborate here at experientialanatomy.yoga, free newsletter, lots of goodies.
Yeah.
Thank you so much.
My pleasure, Lizzie.